Well, we also told you we'll take you down to the market and the streets and get to know what the authorities are doing in this period of the mini lockdown as far as this coronavirus infection is concerned. And I have the head of Food Enforcement Department, Chief Regulatory Officer, Mary Lovely Johnson of the Food and Drugs Authority right here with me. Good morning to you, Mary.
Good morning.
Yeah, great. Again, great to have you in the studio. But since the president's own directive, we have to take the conversation on from there. For you as an authority, what have been some of the implementing measures so far put in place?
We have intensified the education in food safety, because really we have food handlers who are handling food, and then it has to do with your hands, definitely. And because people have to be washing their hands often, we are telling them, do that often. Whenever you are about to touch any food, wash your hands. When you are even cooking and you have to take off something like take a raw material, wash your hands properly. Don't sneeze onto the food. Well, there is no evidence right now that it is foodborne. It cannot really, as it is now. The COVID-19 is not transmitted through food. But then, if you have to sneeze, don't do it on food. If you have to cough, don't do it on food. If you have any symptoms, just report and stay away from the food preparation area.
Of course, scientifically, medically, we know that food cannot, or the disease cannot be transmitted through food.
Exactly.
But it's through the contact and the handling of food that then generates the problem.
Yes.
In a typical situation, where, for example, we go to the market very often, we have a whole campaign where we've put together for a couple of months now. We call it the Joy Clean Ghana campaign, with which we have the Metropolitan Assembly of Accra, and then also enforcement regulators within the assembly and our team going around the various markets and sometimes residential areas looking at how food is prepared, and the sight is just not good. In such circumstances, how is your education synchronizing with how that can be prevented or improved based on what is local?
Well, yes, talking about improvements, we know how some of the places are not good. We're still doing a lot of public education and doing more of the enforcement, ensuring that they do not cook in such places. So we, in collaboration with the metropolitan and municipal and district assemblies, are ensuring that these places are not used as food vending sites or food preparation sites. And so really this COVID-19 thing haven't come into, we're linking it with food safety. Food has to be prepared in clean places, clean environments. So it has to be a clean environment, and handlers more especially have to ensure that they are not transmitters. So they have to wash their hands with soap and under running water. Emphasis on soap and running water, because people just think if they have a bowl of water, they can just be washing their hands. That's not the case. It has to be running water. So even if you don't have municipal running water, you can have a Veronica bucket. That's an improvised running water. So when you talk of Veronica bucket, people don't really know what you're talking about. It's just a bucket with a tap on it. So you have the tap there, and then you can open, you have your water in there, and people can just wash their hands. We have the tippy taps too, where people use their, it's pedal operated kind of thing. It's being used even in rural areas so that you can have running water. If you can't, for any reason, have any of these two, you can even have someone pouring the water on your hand. There is no use having a bowl of water and every Tom, Dick and Harry washing his or her hands in the bowl. Actually, it's not like there is no use. It's even worse than not washing your hands, because you end up getting your hands contaminated. And so washing of hands should be done often, and then sanitization of the hands. You can even use just alcohol, rubbing alcohol, if the sanitizers are not available. And just yesterday, the president met pharmaceutical companies and had a meeting with them. Our chief executive was present. We're going to see how we can facilitate the manufacture of sanitizers and get them registered as soon as possible, and then the general public can buy them.
Right. And we'll take you through all the information that is going out there, etc. But I was having a conversation yesterday with a friend, and she said, "Oh, na say Diana no cry no ana shishe." But in such circumstances, where is the need for us to handle the food safely? Is it when we're cooking it, or after we've cooked it, and the handling or the packaging?
Both, actually. But then, as she said, but do we eat it? That's where the problem is. We don't. We cook, yes, but people normally don't eat it piping hot. The COVID-19, the virus, cannot be able to survive more than 70 degrees Celsius. It cannot. So it can be destroyed at 70 degrees Celsius. But do you eat the food at 70 degrees Celsius? So with the friend knowing that, what he or she has to know too is that the storage of the food at the right temperature is so crucial, such that when you're eating any food, as it says now, it has to be piping hot. As much as possible, cook all you can. All you can as much as possible. Yes, we know we're encouraging the eating of vegetables, that's the salads and all that. But if it can even be sauteed and gotten, you can get it hot, and that's fine, at least for this period. It has to be piping hot, so you know that you have eliminated the virus. It's not either you can and that's actually the point.
Right.
So you eat it hot, and you know that that is eliminated.
Now let's get onto the screen. So on the line we do have Lucia Dai. She is Executive Secretary of the Pharmaceutical Manufacturers Association of Ghana, the PMAG. She was part of the group that met the president, of course, and it was all to find some ingenious ways where we can have indigenous companies providing some good solutions to the current crisis by way of their contribution. And we're talking pharmaceutical industry. Good morning to you, Lucia. Now, when you met the president, the consensus you had was that you were going to immediately get onto your factory lines and start producing sanitizers at subsidized cost. Is that the case?
Good morning to your cherished listeners, and thank you for this opportunity. So yesterday we met the president at the Jubilee House, and the conversation was on 2 points. The first one was on how we can support with preventive therapy and how we can make supportive therapy available. So on the point of preventive therapy, yes, you have the hand sanitizers and other disinfectants. There are 3 companies, manufacturing companies, that are making hand sanitizers. And it's interesting to note that once we make the product and they get onto the market, for some strange reason, it gets finished and then the prices are going up and all that. So the president of the Pharmaceutical Manufacturers Association of Ghana has directed members to reserve some of their lines, which are used in manufacturing other products, to actually manufacture products for COVID-19, and the hand sanitizers are inclusive. So we would see an increase in the production, and hopefully every citizen will be fine. The second point is on the supportive therapy. So we know that currently, the people that are infected, there are people that are able to recover. So for those people, it is because they are getting effective supportive therapy. So the discussion is on ensuring that the raw materials and everything else that is needed to make those supportive therapy is available, so that in the event that we have people who are infected, so currently we have 6 cases, every other person would actually be taken care of. So that was what the conversation was about. So yes, we are going to ensure that the prices of hand sanitizers would be affordable for everybody to be able to access it.
Supportive therapy, what does it mean? You're providing vitamins or what? What exactly is supportive therapy?
So supportive therapy, we have a list, and kindly, if you know that some countries are actually even restricting medicines. So you have India restricting about 26 plus molecules, and finished products or formulations. Some of these include something like paracetamol. Most of the patients would have fever. If the patient has fever, the patient needs paracetamol. It's important that as a country, we are able to have enough raw materials so that we can take care of our own people. Most of the time, we rely heavily on, let's say, imports, and imports especially from Asia. So if we have these raw materials available, then we can ensure that anybody that's affected would actually be taken care of. There are other therapies that are being tried. We have chloroquine and a few others, which have been restricted by UK. UK has restricted currently chloroquine, hydroxychloroquine, and some ARVs. So we're ensuring that all of these things are actually available so that we'll have everybody well taken care of when a person is affected.
But let me ask you this, and since
I'm sorry, your voice is a bit low.
Okay,
I can't.
Don't worry. Okay, I'm sure that you may hear me as my sound technician raises the voice for you to be able to hear. But I know that many of your members tend to source their raw materials from Asia, especially. Is that not the case? So
most of the raw materials, yes, APIs are manufactured elsewhere and are brought into the country. So we rely on Asia. With COVID-19, Asia is kindly not giving us some of the raw materials that we need. So before this time, we're working with the Ministry of Health to ensure that we had good quantities of APIs. Europe is another place where raw materials can be sourced from. So, I mean, they are always looking at different ways of ensuring how we can take care of the population. So, yes, we do bring in raw materials and we do have good quantities. And we are still working with the Ministry of Health and the working group that the President helped us formulate so that we can ensure that in whatever point that help or need is, in whatever point, we'll be able to help people.
Now, since how you source the materials are always on the supply and demand side, and we also know that Asia and Europe now have been badly hit. Despite your intentions, it could have some implication, won't it?
Yes, and that is why it's important to be proactive. So the good news is that, yes, we have some stock already before these ban, came in. And then, of course, at the governmental level, it's important that governments are able to speak and have a certain agreement because, I mean, if you don't take care of me and we still have people traveling here and there, then there's that possibility of reinfection in various countries. So we have some raw materials, and yes, we do rely on people bringing raw materials from Asia, and we would rely also on the government discussing with other governments to ensure that raw materials are available in whatever scenario that they are needed in.
Yeah. Okay. So how closely do you work then with FDA? Because we're having a conversation with you alongside the FDA as well. But how closely do you work with them, knowing that this is a new drive, so to speak, based on the consensus or the agreement you have with the president and the presidency?
We work very closely with the FDA. So FDA is the regulator. Of course, FDA is Food and Drug Authority. So everywhere there's medicine or there's drugs, you would know that FDA will be regulating it to ensure that we have optimal or something that's very effective or safe for all the citizens. So, yes, that's what we are doing currently. We do work with the FDA.
All right. Thank you very much for your incisive contribution to our discussion this morning. Lucia Dai is Executive Secretary for the Pharmaceutical Manufacturers Association of Ghana. They met the President of our Republic, Nana Addo Dankwa Akufo-Addo, on Monday. And the objective of that meeting was to find more suitable means by which we can augment supply of pharmaceuticals and other products on the preventive side and do the supportive one as well for the clinical purposes. And that also means that when you're working closely with them, we have to make sure that while we speedily want things done, we also get the right sort of combinations in terms of the compositions and all that.
Exactly. Actually, the mandates of the Food and Drugs Authority is to ensure the protection of public health and safety. So in as much as we want things available on the market, we will always ensure that our mandate is carried out. And that is ensuring that the product is safe and of good quality. And that, so really safe, efficacious, and of good quality actually. So we will do the needful because that is our mandate.
And especially within these times when demand of products have become, whether on the food side, on the pharmaceutical side, because they are ingestibles, have become very high. Does that mean that your normal regulatory actions are going to be intensified?
Yes.
Or by what form?
Yes, it is. And actually, we've given out a list now of all the registered sanitizers on the market, such that nobody at all just gives you anything that could be harmful. We have the list. I think I can even give it to you to show if you so desire. We've just produced it, so everybody knows what kind of sanitizer or which brand of sanitizer is approved by the FDA in Ghana. So if it is not approved by the FDA in Ghana and you use it, then you do so at your own peril. So we really, yes, demand is high, but we ensure that things are safe. And even as we have this issue, people are not going to take undue advantage of it and give you products that are going to cause harm to you. So we are really doing that and we are intensifying that. So we've published a list.
And since the demand is high and the supply is now on the minimal side, because we're not going to beef up, if somebody is using a product that's not, or is able to provide a product that's not on the list at the peril, what do we do?
So you bring it to the FDA, and we are going to hasten our processes.
Yeah, sure.
Because oh yes, we will, because this is a crisis situation.
Fantastic.
So if we have to do some other things and some other things have to wait, we will do that to hasten. We always do that when there is the need, so that will be the priority product, and we'll do it like we'll process it expressly. So
there are important things that we need to take a look at when it comes to the operational of the various components of food pharmacy in the communities. How do you do the coordination with either the Pharmaceutical Council and then what you also do by way of the regulation in terms of how they operate in the communities? The pharmacies, the drugs.
Pharmacy practice is by Pharmacy Council.
In terms of
the practice, yes. Pharmacy practice is regulated by Pharmacy Council. Ours is the medicines, the cosmetics, the medical devices, the household chemical substances that are sold, the products themselves, not the practice as in community practice and all.
But I'm saying that in these times where everything is going out there, while you have approved certain range of product to be used and a number of things are in the markets, how then do you work with these agencies like the council and all that, so that you know that because you have the mandate, but you have the normal or the ordinary Ghanaians' health at heart? How do you do that coordination?
Well, we have our market surveillance out there on the market. We have the market surveillance department, and now that this is an issue, they are even focusing more on that, so that we ensure that the products out there are safe, efficacious, and of good quality. And then we do a lot of collaboration with the Pharmacy Council. We do a lot of collaboration even with all the other agencies that matter. We really do a lot of collaboration because we know these kind of things are things that consumers use. So we do a lot of, even with the consumer, we tell the consumer, if you see something and it's suspicious, just call FDA. We have open doors. We really like the whistle blowing thing and all that. So we collaborate with everybody. We know that our business is everybody's business.
Do you know a community like Ashama?
Yes.
I grew up there.
Okay.
And I don't know how FDA will be operating there.
Oh, our market surveillance is almost always there. Yes. We go with our buses. We are there, especially even with the food market surveillance. We are always, because Ashama has a lot of these people selling things that are expired, and we are always busting them. We are. But I'm sure they now know our bus. When our buses are coming, they can tell that these. I guess, because really we are always there, because we are one of the very naughty places, and we are almost always there. Get to a warehouse that they said, we get the tip-offs. You hear there's some warehouse lot somewhere. When you go through to it too, it's there. And quickly we ensure that there is a safe disposal, and we give them all the penalties and all of that. So we really know what's happening there, and we are on top of issues. And if there are any more, just give us the tip-off.
Okay, so this is what we want you to do. We want you to call in and help us with the discussion as well, because it's supposed to be educative, not just feeding you content and then you're not contributing. So we have the lines on the screens. Make sure you call 03022116991 or 2. We do have a chief regulatory officer and also head of what's your post again?
Food enforcement.
Food enforcement, big post. Mary Lovelace Johnson is right here, Food and Drugs Authority, and please join us with the conversation or in the conversation. The numbers are on your screens, but in the meantime, let me just read a couple of your messages. This one is from Osei Boating Tano. So he says that I love what the woman is saying. However, we have many areas in Kumasi where cooking and medicines are being sold indiscriminately. How is the FDA combating this?
Where cooking and medicines are being sold indiscriminately.
Where food that's cooked and medicines are sold indiscriminately.
Yes, the FDA has a market surveillance department, as I said earlier. We are always out there trying to get people to do the right things. If there is food if it's prepackaged food and they think that we haven't seen, just draw attention to it. There are quite a number that we see, and then we let them do the right things. Sometimes too, if it says, I don't know what he's talking about. Is it a street vended food he's talking about, or just the prepackaged foods? We take them off the street. Then once in a while they get back. When we know that we have to be there but the point is that, you see, we cannot be everywhere all the time. So we have a timetable. We know when we have to be in Ashaiman, like you said, as your police. We know when we have to be in Kokomlimli because Joy News is here. We know when and where. We have a timetable, and we can't be everywhere all the time. Meanwhile, when we have a tip-off, we can just stop whatever, go there, and exactly.
Okay, let's get onto the phone lines. We do have Sami. Sami is calling us from Takwa. Sami, good morning to you.
Yeah, good morning, please.
Yeah, great. You've been watching the conversation or listening in. What's your contribution so far to the subject?
I just want to ask a simple question. Food and Drugs Board, are they working only Accra or other regions and districts and municipal?
Just wait. Let me take the
If
next.
that be the case, we are not seeing much input at Western, especially Takwa side, please.
What do you mean? Is it that you want to see them in your home or your office?
Yeah, their work. We don't see them. We don't see them functioning at Takwa. As he's staying at Accra, the moment they see their cars and they start panicking or do the right thing. But Takwa here, we are not seeing it. A lot of things are, especially the issue that the sachet water that we are drinking. A lot of them are I don't want to mention it, but
they are substandard by your estimation.
Come again.
Yeah, you saying the pure water or sachet water you drink?
Yeah, the sachet water that we are drinking at Takwa here. Most of them are not registered or are not well put up.
All right. Thank you very much, Sami. Now straight away to my town, Shaiba. And I have Stephen there. Stephen, good morning to you. Stephen. Well, Stephen is off. And but so just answer. Takwa, what's your presence?
We have an office in Western Region. It's the head office is as in the Western Region. Head office is in Takoradi. So our office is in Takoradi, and they operate everywhere in the Western Region and the Western North Region. So we go there, and as I said, we have timetables. I mean, we need to be here this date and on such a day and all that. But we go to Takwa. We work in Takwa. And if he has any particular problem, he should just let us know, and then we will just sweep in there. And when it gets to places like that, because FDA cannot be in every nook and cranny, we even work with the municipal, metropolitan and district assemblies.
Metropolitan municipal
district assemblies.
All right. Yeah. So let's go to Medina. And it's where Yao is calling from. Good morning to you, Yao.
Good morning.
You've been following the conversation. I hope that you also get educated on related issues right here on Joy News on coronavirus. Please, your contribution, Yao.
Yeah,
Yao.
Yeah.
Please reduce the volume on your set so that we can talk.
Mine has to do with the power outages in relation to Food and Drugs Board.
Please reduce the volume on your set or your TV
Yes,
set.
I've done that.
Okay, so let's talk.
I'm saying that mine has to do with the power outages in relation to Food and Drugs Board. In relation to Food and Drugs Board. Now that there is power outages all over the country, and food and other medical whatever are going bad. What is Food and Drugs going to do about this? Because I mean it's very serious.
Okay.
This is not a time Gridco, ECG or so ever should be cutting power.
Yeah.
Because the little we have, we are preserving it. And some of the preservations are the restaurants, are the supermarkets, everywhere. You get me?
Yes,
now that
I get you.
Electricity is going off. What is Food and Drug going to do about it? Because people are going to consume as wholesome goods.
Right. Well, thank you, Yao. Now let's go to Jamestown. Jamestown. No, let's go to James in Techimai. James.
Hello.
Yeah.
Good morning.
Yes, please. You're calling from Jamestown in Techimai, or where?
No, I'm calling from Techimai.
Okay, please.
Precisely New Inyanase.
Okay, New Inyanase in Techimai.
Yeah.
And it's James.
Yeah.
James, please go ahead.
I want to know the Food and Drugs Authority. Many, as the president said, that we should try and help ourselves with the local production and consumption. There are a lot of drugs that they have registered, herbal drugs. Are they trying to look into it if any of the herbal drugs maybe could help with this pandemic that has come?
Okay, that's a great question. That's a great question.
Able to
The local drugs, the herbal drugs that you have registered, whether any of them could cure or something, whether you are interested in that. Okay, so let's go to Yao first. Yao is first worried about how food and medicine could go by because they are intermittent power cuts.
Well, that is not up to the FDA to say, as in his problem is actually with the intermittent power cuts. It's not so much as to the food, if I got him well. But really, we're doing a lot of public education, letting people know that food has to be wholesome. And so if it is that your food, by virtue of the fact that you're having power cuts, has gone bad, you don't have to sell it. And the one buying to, you don't have to buy food that has gone bad. This really has nothing to do with COVID-19 really as of now, because that is something that we're talking about, droplets, respiratory droplets and all of that. So it really is not part of today's discussion. But if the public education has really gone well, then nobody has to take food that is not safe for human consumption. And the good thing about these foods that go bad to is that they may smell bad because there is decomposition and all that. So it's a fine indicator for you to even know that it's not edible.
And James from Techimai wants to know whether you've registered drugs or the drugs you've registered, whether you go to the extent in these crucial times to find out whether they could also help in.
Well, there are research institutes that do that. Food and Drugs Authorities to ensure that the food that is, or the food, the drugs, cosmetics, and all of that, they are safe, they are efficacious, and of good quality. So if the manufacturer says that my food is going to cure ABC, we look at it, that does it really cure ABC, the efficacy of it, the safety of it, and in curing, it's not going to end up giving you another disease, and it's of good quality.
You look at all that.
Yes.
All right. Let's go to Fatal. Fatal in Tema.
Good morning.
Fatal, where in Tema are you calling from?
Constituent 5, please.
Right. Please go ahead, Fatal.
Yeah, please, I want to find out from Food and Drugs Board if they've been doing their checks in some part of the northern region, especially with the district, because in most the pharmaceutical stores that we have, or let's say the drug stores, most of them do sell these substandard drugs there, and then it is affecting a whole lot of people because no one comes there to check there, and whoever brings the product there do sell them anyhow. So I don't know whether they've been coming around those places, especially the district in some part of the northern region.
Now, you said they sell what there? What exactly did you say they sell?
Substandard draft.
Substandard. Okay, Fatal, thank you very much from Tema. And Joseph.
Yeah, but Joseph, ne kasa fi mo for my crew.
Oh, okay, say free, eh?
Do my crew mo hafu.
No, okay, my pacho.
But food and that's for you kakra na pekene kana. But I say do my crew. But me kasa fi do my crew.
Pacho koso.
But I say what you move food and that's board no. Adumana I say gatas ne normal bi amodi genetic gatas na so abem mo tonton. But me want a mombia by a day by no. This is almost taking measures. This year, I can create a more just for. I'm on taxi this year and the answer by a but some few days ago, no, you know, what's not the young kind. I mean, how do you food and that's what the movie has a better work. The money created in some question, you could do another book, month for my bedroom. You take that and money, you know what? And what? Nsana mapo na ko on say stray kids no be free inside could be border na no be ba okru ha nyan san be bi ho o to ton to me say fit and that for take measures bi okru ha e pa
Hey, when I say Joseph from Domain Co, and we'll touch. It's about the influx of food, drinks, and drugs from other neighboring countries and also bordering the borders. And he says that he doesn't or hasn't so far seen the presence of the FDA in his locality.
Well, FDA is in the Bono region. We really have an office in Sunyani that takes care of all the other and even the new regions, the former Brongahafo region and all the others on, and we have our presence there. And if he's talking about Domahinko having these products coming in from neighboring, you know, we have porous borders. That's one of the issues. Otherwise, we have entry points, the approved entry points. We have FDA stationed at all the approved entry points.
So if it's not approved points, then you have no hand.
That's why I'm talking about the porous borders, because if these things are coming in, then it may come in from these unapproved routes.
Let's say they are coming from porous borders.
Maybe. Then the market surveillance team sees to it. Really, we have steps. It shouldn't even get in at all, and that is why we have people posted at the borders. But those that come, yes. So we do at each stage. Now we have the market surveillance, and market surveillance works. Actually, we really work in ensuring that these things are off. However, his things are still there. He should just let us know where and where. Maybe we can talk to him offline, and he can tell us where we can find the things. And then we will be able to.
Okay, we have to wrap up, but before we go, okay, you've also provided guidelines. Which hand sanitizer?
Yes.
Okay, so we'll take viewers through. Use FDA registered hand sanitizers as they are effective against the virus. The FDA is fast tracking the registration of hand sanitizers,
as I said earlier,
to ensure their availability on the market. I'll bring you one so that you quickly approve.
Yes.
Check the expiry dates on hand sanitizers before you buy.
Yeah. So we have the list of the hand sanitizers coming up. Yes. So that you have all these approved hand sanitizers.
Okay, we'll try and blow it up and see whether we can get it. So this is the product name and number of them.
If
so
all the
new one I'm bringing, you'll feature next.
Yes, it will, exactly. So viewers should take care of these, take note of these, and when you are buying, ensure that it's one of these. Fantastic. If not, you do so at your own peril.
I love, you like using peril. At your own peril. Now, last piece now.
Yes.
Apeteshi. People are saying it's good to wash hands. Just explain. You know, in our parlance, we seem to think.
Yeah.
Apiono locano and 100%. Explain to us.
You know, the production of alcohol itself, the one that is not drinkable. should give you something like 80%, 90%. Actually, they normally don't even have the right machines. If they have the right machines and all that, it should start around 90% thereabouts. Actually, we're even working towards 100. But as it is in this country, using their drums and all that, they have around 80% and all of that. That is really the alcohol, but that is not edible. That is not the alcohol that is drunk.
You mean the one we get at the farm gates?
The Nungwa and the places where the people,
the palms,
the ones that are produced there with the sugar cane.
Yes.
I remember way back in secondary school, we went there to see some of those ones are the pure kill the germs or the kill the, in this particular case, the virus, the coronavirus. Now, the one that is drunk is 40% thereabouts. Usually. 40 is for consumption. So if they think it's the one that is for consumption, then they're getting it wrong.
Because
that's what they think. So if they want, then the ones over there that are not edible, and that one, that is the one that will do the sterilizing purposes. And that one too will betize you if you even taste a little. You are gone.
And wash it.
It is not supposed to be drunk. It is not consumable. I mean, you cannot consume it. It's not edible. But that is the one that you can use to do the sterilizing things, the rubbing alcohol thing. That one from the source, that is not drunk. So let's not mix two things here. Okay. The one that is not drunk, that is drunk. The 40%, the 38%, the 42%, it cannot do the killing of the coronavirus. It is not up to 70%. So people say, I had vodka, we have this. That is not up to that. If you want appetition, yes, it is true. But it is the undiluted appetition that cannot be drunk, that can be used for sterilization purposes. Please, I hope we get it very clear. It's so crucial.
So you're saying the one we find locally there, this one, the one in the city center?
No, they shouldn't go to a bar and think that. It cannot be. It cannot
because under normal scientific purposes, you cannot drink it. It's not ingestible.
Exactly.
By the time you do that, you have some
you will die. Problems. You will even die. You even die. It's not that one. And normally we have the ones, we call them denatured alcohol. Denatured alcohol. We add, let me not go into too much science, but then it's like, those ones are such that it's not even supposed to be drunk. So they even sometimes it put something in just for you to methylate it and all of that, such that it won't even be drunk. So that one is not drinkable. The drinkable one too is not coronavirus killer. So we need to get it very clear. The drinkable one cannot be the killer of the coronavirus. The non-drinkable one is the killer of the coronavirus.
Mary Lovelace Johnson, you're a Chief Regulatory Officer, FDA, and so you're head of also
Food Enforcement Department.
Food Enforcement Department have also bought into your message, and we thank you as well. We've also had online Manufacturers Association of Ghana, and Lucia there helping us with some interaction as well. And all you callers, we say that is the best way for all of us to get this coronavirus contributive